Welcome everyone to another Innovative Health Solutions webinar. My name is Dr. Wallner, and today we are talking about how to sleep better. If you've listened to any of my webinars before, you always know that we start off with the mission statement here at IHS, which is to foster the highest standard in primary natural health care. Just a little bit about our values. We strive to improve and restore the quality of life of every patient by fostering physical, emotional, intellectual, and spiritual health. And our other value is emphasizing the importance of chiropractic adjustments, nutritional support, and natural therapies. So before we get into talking about sleep here, I do want to encourage you to find us on social media, whether that be on Instagram, Facebook, or YouTube. We do often post informative videos and documents and articles about health and wellness that keep you informed and up to date. So today we're going to talk all about sleep. We're going to unpack how sleep works. We're going to talk about what affects our sleep. We're going to talk about why you should see your chiropractor if you have any sleep issues. And of course we're going to talk about practical applications, things you can do today, what you can do about it, of course, aside from a good old-fashioned chiropractic adjustment. As a rule to start, you always want to rule out monsters, because if you do have monsters under your bed, you're probably not sleeping well. First of all, let's talk about the importance of sleep. Sleep is one of the great mysteries of life. Like gravity or the quantum field, we still don't understand exactly why we sleep, although we are learning more about it every day. We do know, however, that good sleep is one of the cornerstones of a healthy person. We need about 6 to 8 hours of sleep for most adults each night, and sleep deprivation is such a chronic condition these days that you might even not realize you suffer from it. Okay, and this has far-reaching effects on our health. It weakens our immune system, tumors grow faster when we don't sleep, it can cause a pre-diabetic or a dysglycemia or dysfunction with your blood sugar if you're not sleeping well. It can severely impair your memory, which kind of gets into a talk of leaky brain. So I encourage you to check my webinar about leaky brain. And it can also impair your performance on physical or mental tasks, especially your ability to problem solve. A little bit about our ideal rhythms for the day. Back when humans were more active, in the agrarian culture or society, farmers would get up when the sun came up. They would get that full spectrum sunlight all day. They would work really hard in their field and get plenty of good exercise. And then at night, when the sun went down, they were exhausted from working so hard, and muscular tiredness, and a combination of it not being light outside anymore. All of these are signals to our bodies that it's time to rest and it's time to sleep. Today, in our modernized, westernized culture and society, we don't get those same stimulations. We're always stressed. Some of us work night shifts, so we're up, from 11 to 7, or 10 to 10 with a 12-hour shift. But fast food, processed food, our night shift lifestyles, this has all significantly impaired our biological function, which manifests itself as compromised sleep. So what I want to get into is sort of the meat and potatoes for tonight, is talking about our circadian rhythms, okay? We got two hormones, cortisol and melatonin. These hormones oppose each other, and the dysfunction of these two hormones is a major model for most patients that we see in the office here who are struggling with sleep deprivation or chronic sleep issues, okay? Here's a chart or a graphical representation of how these two hormones are in opposition of each other. And so this would be a normal or an ideal representation of what we're looking for. All right. When you feel awake in the morning, that's because your cortisol is supposed to be higher in the morning. When you want to go to bed at night, your cortisol is supposed to be low at night. And exactly the opposite with melatonin. Melatonin helps you fall asleep at night, and it should be low in the morning because that cortisol is going to help wake you up. So we get patients coming in who tell us, they don't feel like they can wake up, and that's probably because their cortisol is so low. We can measure cortisol here in the office with a simple adrenal salivary index laboratory test. It's a saliva test for those people who really want to see it on paper. but ideally with just a little bit of applied kinesiology or muscle testing and some subjective history from the patient, we can figure out with a pretty good accuracy of what's going on and what nutrition, what supplements we can work with. Continuing on, our understanding of how this works, this is a brain-based mechanism, okay? Specifically, the part of the brain that I want to talk about is this part right here, the hippocampus, okay? The hippocampus controls your cortisol, melatonin, and plays a lot into the hypothalamus pituitary adrenal axis, which we talk a lot about here at the office. But what we're finding is people are so stressed out now, the usual fixes of the adrenal glands, the adrenal supplements, the things that really help out the glands themselves aren't working. We have to go higher up in the chain to get a clinical response. So again, hippocampal degeneration is a major model for many chronic illnesses today, and one of the major ones is chronic sleep deprivation or any kind of a sleep issue, okay? And it's very difficult to break this pattern. It's almost like you have your foot on the gas and it's just like you have a lead foot. Like you can't take your foot off the gas. So you need something to help lift that foot off the gas slowly and reset those cortisol rhythms. Okay, so now that we understand what's going on, let's talk about what causes it. Okay, stress, processed foods, sugar, alcohol, smoking, leaky gut, intestinal permeability, leaky brain, a leaky blood-brain barrier, dysglycemia, blood sugar imbalances, psychiatric drugs. If you're on any kind of an SSRI, a D2 agonist, a benzodiazepine, or anything like that, that is affecting your brain chemistry. And so over time, this can cause a myriad of issues. One of them might be chronic sleep deprivation. Just a little bit more on the psychiatric drugs. Depression is now the #2 cause of disability. So let that sink in. People are so depressed these days that they cannot work. And so they're claiming their disability insurance because they just, don't feel good enough to go out and bring home a paycheck. In 1955, there were 38,000 people diagnosed as depressed, and now it's up to 9 million here in the United States. Some other things that can cause this: irregular schedules. If you're trying to go to bed at different hours every night, lack of exercise. So again, any form of stress can really cause hippocampal degeneration. So what do we do about it now that we know what's going on? Working with your chiropractor is always a great place to start, especially for a functional or a wellness-based solution. And again, this is only one model that we're talking about. There are many other things like insomnia and narcolepsy and interesting things like sleepwalking. We're not really going to get into those in this webinar, but again, this is just one model. So really work with your chiropractor or your medical doctor to figure out exactly what's going on. And we do want to talk about the significant clinical results we're getting with Audrina Calm and melatonin. So one of the ways we calm down the brain is with a supplement called Audrina Calm. Okay, this supplement works on the hippocampus part of your brain, and there's the hippopotamus there to remember the hippocampus. The active ingredient in this supplement is called phosphatidylserine, and phosphatidylserine is nothing new, but this method of delivery is. This is a cream-based product, so you rub it into your skin just like sunscreen. What this does is it allows that phosphatidylserine to get right into your bloodstream, which gets onto your brain, and then resets your circadian rhythm. Okay, this is why it's so effective, and this is one of the tools that we use, again, to affect the hippocampus. Another thing we look at a lot is melatonin. Okay, you may have tried melatonin before, possibly in a pill form, over the counter, just going to the local pharmacy and getting some melatonin. What most patients tell us is that they start using melatonin and it either stops working after a while or they have to take more and more and more for it to be effective. And the reason for that is because the brain works on feedback mechanisms. So if you're constantly putting more melatonin into the gut and the brain senses that, it's going to stop its own production of melatonin in the brain. And so what you want to do is use a product like the melatonin liposomal spray from Vesica, which is a spray that you just spray directly into your mouth, It gets directly into your bloodstream, bypasses the gut, and this doesn't cause the melatonin dependence that we were talking about earlier. Okay? So we use these two products. We also use Cava Forte, which is more of a neurotransmitter-based mechanism that helps increase your production of GABA, which is a calming inhibitory neurotransmitter. So we do often look at Cava Forte as well. So I know we've gone over a lot. I hope you're not getting too sleepy. I don't want to overwhelm you, but I do want to talk a little bit about sleep apnea, and then I do want to get into some practical applications for what we can do about getting better sleep. So we have two main types of sleep apnea. We have obstructive. There are a lot of manual therapies we can do, relaxing on the muscles, sleeping on your side. Obviously, the main treatment is a CPAP machine. But we also have central sleep apnea, which can play into leaky brain mechanisms. So your brain is telling your muscles to relax and breathe, but they aren't getting the message. Okay, there's a problem in that connection. So we do work with patients that have these conditions, and I just want to make you aware of them. Like I said, there are a lot of therapies that we can do for obstructive sleep apnea to help them sleep better. And your lifestyle interventions like exercise and losing weight and eating right are going to be really good for the obstructive type sleep apnea as well. So, how chiropractic can help specifically is by adjustments to your cervical spine, which really influence your parasympathetic nervous system. That's your rest and digest part of your nervous system. So when you get your neck adjusted, you should really feel more relaxed from that motion and from that movement in your cervical spine. So that's one of the main ways that chiropractic is able to help, is by modulating that parasympathetic nervous system. Also adjustments to your low back, the lumbar spine. Those are also really good areas to work on in terms of modulating the effects of the parasympathetic nervous system. Of course, we want to think about the vagus nerve, which is the main nerve of the parasympathetic nervous system. We have some techniques to work on vagal tone here. I want everyone to work on humming or singing loudly, gargling with water. And for those who are really adventurous, you can actually initiate a gag reflex to fire that vagus nerve. We've talked a little bit about organic coffee enemas before at some of our other talks, and we have some other reflexes here. Rubbing a point right between your eyes on your forehead. It's a great neurolymphatic reflex. And then we have some reflexes for the gut on the outside of the legs there. Also, if you've ever gone to an acupuncturist, they may have put a needle in your ear because there is a vagus nerve point in your ear as well. Aromatherapy, or using essential oils, is really effective for calming down the brain because they're going right into your brain. And some oils like frankincense can even cross the blood-brain barrier, but we typically look at lavender for helping people calm down and sleep better. Here's a plethora of alternative techniques that you can try out that honestly don't cost anything. You can set your room at about 70 degrees. Make sure you have no lights on at night. Tablets and TVs and smartphones really throw off that cortisol, melatonin cycle because you're looking right at them in your eyes. Do get regular exercise. Avoid alcohol and coffee at late hours. Chamomile tea. Valerian root is a fantastic herb. Make sure you're taking a really good magnesium supplement. Dark chocolate boosts your dopamine levels, and even consider wearing an eye mask to really make sure you're getting your room very dark at night. And again, always rule out monsters in case you're having sleeping issues. And do check out this playlist that we've created here on YouTube. If you do a Google video search and type in Better Sleep Dr. Wallner, we've got 3 videos here lined up in a playlist that really give you a lot more information. And again, please do connect with us on social media. Follow us on Facebook and Instagram. And do check out our YouTube channel for more great health and wellness information. This is Dr. Wallner, and this has been another Innovative Health Solutions webinar. Thanks so much for attending.